Okay, so preventative treatments now in rabbits, as well as good husbandry routines, correct nutrition. You know the routines for health procedures, so the visual checks daily, physical examinations at weekly or monthly minimally. So we're going to look at other care routines which are a bit more specific to different animals. And with rabbits, as you all know, because I'm hoping you've all had a go on your course by now, one of the things is that we have to have a look at their feet and their claws. So I'm turning her. So George, and you'll notice that she needs a bum cleaning. So that's another thing that I'd have obviously picked up on my physical examination. So in terms of methods of administering, nail foot care goes in other. And so George is obviously looking for how much of the nail is above the quick line. And I can see, I don't know if you guys on the video can see, that the quick is quite close to the edge there. So definitely there's no nail needing to be removed there. And you also can look just visually for whether the claws extend beyond the fur in any way. And obviously do check all of the paws. And because we've just done a live, we did snip off the ones that needed it, so these are all looking really good. So that they're trimmed, especially if the animal's not digging. So that's part of preventative care, and that would be in the other method, the other category. I'm just going to turn her back. She is so beautiful. So another type, which some of you volunteered, is spot-on treatments for animals. And I bet those people that have got cats or dogs will be much more aware of these because we do them much more routinely. Rabbits are prone to, yes, they can pick up fleas, but they can also get lice. There's a type of lice that rabbits can get, and spot-on treatments like this would prevent them from getting those. They need to be repeated really regularly though, if you choose to do that, if your animal is at high risk. And that goes, sorry, we were going to model it, weren't we? That goes like your cat or your dog on the skin. So the method of administering is topical. Goes on the skin at the nape of the neck so the animal can't lick it. And you'd normally put it in 2 locations on that back line, but the animal must not be able to lick. The other thing that I mentioned earlier is that you can get a different type of spot-on treatment, which is ivermectin, and that is the one that you would need to either kill mites or make sure that they don't come back. Again, retreatment weekly 3 times. The final one we're going to cover is an oral dewormer. So the method is oral, which, as you know, means by mouth. So it's a syringe. Now, the dosage has to be based on weight, and I should say that the dosage of the spot-on treatment will also be based on weight. So we're weighing the animal. You know to put a towel on for the animal's safety. Zero your scales, and these dodgy scales come out with a nice inaccurate weight. Put your animals on securely, making sure that they are not left at any point.
Lost weight. 0.59.
It gives you a weight. So I know that this rabbit is a kilo. So we're then going to administer her oral wormer. So I'm putting her in a position where George can easily pull back the cheeks. I've got one of my hairs in her mouth. Pull back the cheeks and put the syringe in the side of the teeth. And you'll see the rabbit, hopefully. Or can you do it the other way so they can see? Is it really awkward for you?
Yeah, this is right. Come down.
Put the syringe in the side of the teeth, and then you'll see the rabbit go nom 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 nom, and you squirt the correct dosage. After any preventative treatment, the most important thing you do is observe any preventative care. Observe your animal, make sure there's no adverse reactions, the animal's behaving normally, and then make a record. And then you're done.